The other R tier item we've actually spoken about earlier, it's taxes.
Avoid at all costs. And that brings us to our R tier. So R for ripoff. So we mentioned one of these earlier, the epigenetic or biologic age clocks. I think a health score would be more appropriate because it doesn't really tell you your age. But if people can see where their health score is on a scale of 0 to 100, I think that would be a far more valuable tool to build on your health journey.
Yeah, stay tuned for more info on our health score. I know that we've talked about this before with Dr. Taylor Martin, board certified preventive medicine physician from Johns Hopkins and master's in public health, data scientist as well. But 1,000-foot view on this is a lot of times they use that to sell you another product, and they're kind of using the biologic or age clock as a special sauce to justify marking up something to a margin of several 100%. So watch out for those. And again, just because somebody has one of these included in their service, some people are just curious and they want to know. Some patients want to know their DNA pheno age, and our staff will occasionally help them calculate that. That way they, sometimes you're just curious. I wonder what this would come back as.
The novelty of it.
Yeah.
It may not be particularly useful, but it's interesting.
Yeah. If it comes back particularly bad, then if anything, maybe it's a bit of a reality check of how your lifestyle has been lately, or just to talk to a doctor again, if you're not. But there's not a whole lot of use to this. The other R tier item we've actually spoken about earlier, it's taxes.
Avoid at all costs.
Yep. Well, avoid as you are as you are able to and not obligated to.
Yeah, so if there is a podcast out there that gives you a balanced approach to taxes, we would love to know it. Please let us know in the comments.
Yep. This is not financial advice, and we are not accountants or attorneys.
Definitely not.
Yep. And we do not have any accountants or attorneys on our clinical advisory team. And you probably don't have any reason to have a physician or a nurse practitioner on your financial advisory team.
Very true.
The next tier, I guess, is the question mark tier. It's one of our pet peeves. It's proprietary blends.
Yeah, the secret sauce. And you can kind of guess based on the total milligram content of the proprietary blend, and then how many ingredients are in there and which ingredient is first and last, whether this is effective or not. General rule of thumb, no, especially if the dose of something that's effective is several thousand milligrams and the proprietary blend is 465 milligrams. Almost 100% chance that product is not going to do anything.
Yeah, there's one of the energy drinks, and maybe our friend Derek did a scientific dismantling of this energy drink, but I believe it had taurine extremely low on its ingredient list. It had natural flavors higher than taurine, and an efficacious dose of taurine a lot of times, 1,000 milligrams. So,
several grams.
Yeah, there's probably no way then that it had more than 1 milligram. So definitely a sub-efficacious dose.
That's a great example.